Hello, and welcome to Ask Dr. Amy. Today we'll talk about a topic that can be difficult to talk about, but I think all the more important to tackle for that reason. And if you just had a new baby, congratulations, very exciting times. But I know that this can also be an anxious time. So our goal today is to look at what we know so far about sudden infant death and the best recommendations to prevent it. The evidence for today's video comes from a consensus article by the American Academy of Pediatrics. That's the governing body of pediatrics in the United States. The acronym SIDS is the one that we use a lot, but as we have learned more about these cases in the last few decades, we have more detailed official definitions now. The umbrella term for everything is now called sudden unexpected infant death. Unfortunately, these cases are not always unexpected. Most of the time we know the reason: an infection, an injury, a pre-existing condition, etc. Sudden unexpected cases tend to happen at home, tend to be unwitnessed, and are in otherwise healthy infants that we expected to do well. So under this big category, there are two important groups: the known reasons and the cases with unknown reasons. Over on this side, under the unknown reasons is where we have SIDS, sudden infant death syndrome. And the new definition for that is those cases where we don't find clear, conclusive cause of death after home visits, after interviews with caretakers, sometimes after autopsies. Under the known side, by and large, these are sleep-related causes. That's why we're going to talk a lot about sleep safety today. It's important then to note that between SIDS and the sleep-related sudden infant death, between these two sides, the conditions and circumstances are often the same. Let's use an analogy here, and stay with me because there's a reason I'm going on and on about this relationship between these two categories. Let's say on the known cases, we have cases of kids falling. And over here, we see them fall because they were running fast, because the ground was wet, or they tripped on something. Now let's compare these cases to another group of cases where the kid was found having fallen, but nobody saw it happen. But then we look around and we see that, or we know the kid and we know that he or she likes to run fast. We see that there's water on the ground, and there are furniture or other things around in his way that were likely to have tripped him. So you see, this gives us a good clue of what probably happened, what probably caused the fall. But technically we can't say 100% because we don't have conclusive evidence. So in the same way, when we look at SIDS and the other sleep-related cases, we say, oh, there are a lot of clues that tells us there's something going on. There's a relationship between these categories of cases. So even though they're technically separate, what we learn from them can be the same things, and the recommendations that come out of them are the same as well. So in the world of risk management, we talk about outcome over condition. That's the risk. So when these two categories have the same outcome and very similar condition, then we can say that the risk factors are probably the same. All right, so the reason I talked about all of this on and on is that the recommendations we'll talk about in the rest of this video apply to everybody. When we think of unknown causes of death, especially in babies, it makes us anxious and feel out of control. But by making the sleep environment safe and following these recommendations, we're not just preventing or decreasing the risk of the known cause cases, but we're really making the environment safer for everyone and preventing SIDS cases as well. But as you know, medicine always asks for the next question. What other factors could have played into the SIDS cases? Maybe there are things that we haven't discovered. So for example, one study looking at brain chemistry is trying to link different levels of a hormone to different vulnerability to smoke in the environment, which is one of the known causes of unexpected death. These studies really make it more important to follow the guidelines over here under the known causes. A second study, for example, is looking at slight mutations in the heart that might make a kid more susceptible to unsafe sleep environments. So in these cases, it's not that the recommendations should be different. You can actually argue that they become all the more important. All right, let's move on to talk about the actual recommendations themselves. Number one, it's something that often gets mentioned first, and rightly so, and that is putting the baby to sleep on his or her back, face up. Or if you speak Spanish, mouth up. This was one of the earliest recommendations. So when SIDS first caught the attention of the medical community. And in the 80s, after analyzing some of the cases actually from other countries, the first recommendation in the early 90s was to put the kid to sleep on his or her back. That recommendation has brought us the most dramatic decrease in sudden infant death cases so far. The whole idea of safe sleep is to prevent accidental suffocation or strangulation, because the baby's respiratory center, the part in the brain that regulates the breathing, is not mature enough yet, and in situations where an older kid can readjust their face, babies just don't yet have the signal pathway or maybe the head control to do it. So putting them on their back to sleep with their face up and exposed is the safest position. And one common question that comes up with this is, what about if the baby has reflux? What if they choke? What if they spit up? That's a smart question because we instinctively think of turning someone on their side if they'll vomit. But sleeping supine is safe for baby even with reflux and spitting up, because there are anatomical structures in the throat to prevent them from aspirating, which is choking, or spitting up, inhaling it back into their lungs. This mechanism they don't have to think about is automatic, and in healthy, normal babies with normal anatomy, that should protect the airway and keep the baby safe, even if they spit up while lying flat on their back. The American GI Association, or the doctors that are in charge of the gastrointestinal system, agree with this recommendation. Now, an important exception to this would be babies who have anatomical abnormalities that fail to protect the airway, so they can't aspirate, and in those cases, both feeding and sleeping recommendations might change. Please go see your providers and follow their recommendations. An example of this would be babies who have laryngeal clefts. These are different from cleft lip and palate. Laryngeal clefts are in the throat and can increase aspiration risk before they're repaired. So when in doubt, ask a doctor who knows your kid's medical history. So aside from these exceptions, put the baby on his or her back to sleep every time. When they get older, they can roll over, and you don't have to roll them back and wake them up. But newborns especially cannot roll. But either way, start them sleeping on their back each time you put them down. And this recommendation goes up to about 1 year of age. All right, number 2 is the surface that they're sleeping on. It should be flat and firm. The firmness should be even throughout to prevent pockets and dips that a baby's face can get stuck in. So memory foam, no good. The point of the foam is to conform to the body and stay that way. So that's especially dangerous for accidental suffocation. So no fancy mattress, anything complicated, just simple, flat, firm surface. As for flatness, again, there are questions of whether an incline would help reduce the reflux. And by the way, all babies reflux. We'll do a separate video on that alone. But for now, so after they feed, yes, they should be kept upright, and they can certainly sit in an inclined chair or in their car seat while you're watching them. But while sleeping, again, they need to be flat. Putting them on an inclined bed increases the risk of rolling down and being stuck at the bottom, which is really dangerous for accidental suffocation. So when you're ready to put them down and leave them to sleep, make sure that the crib surface is flat. Now there are a lot of products out there, different beds and cribs you can buy. If you're ever in doubt, there's a great resource called CPSC. It stands for Consumer Product Safety Commission. And it's .gov for their website. Their entire job is to look into things that are sold on the market and look into their safety standards. So you can see exactly whether a bed or a crib or anything for the baby is recommended as safe before you buy it. All right, speaking of the beds and places to sleep brings us to the next point, which is where should the bed or crib or bassinet be? The safest place for the baby to sleep is in the room with the caretaker or the parents, but in their own bassinet or crib. There's your very square bed, and here your baby is in the same room but in his or her own location. Now the issue of co-bedding is very complex, and I know that there are some cultural differences here. In some countries, it has always been the norm to co-bed, so it can seem sort of unreasonable for your pediatrician to say, oh, you can't do that anymore. The recommendations here come from cases of babies being accidentally suffocated by a sleeping adult or falling out of bed, etc. So these are the exceptions or accidents rather than the rule. But because they happen, that's why this recommendation was born. A good compromise, I think, for parents who really want their kids next to them during sleep is to temporarily move everyone to the floor. There's no way they can fall to. The floor is flat and firm, probably a safer consistency than most adult mattresses. And on the floor, an adult is less likely to roll onto a baby and not notice in their sleep. All right, other options. Now, there are products out there for the baby to be attached on the side of the parent's bed or in the middle of the bed, but walled off in their own little space. The task force, or the group in charge of coming up with the official AAP recommendations, could not make an official call on this because there's not enough evidence. There hasn't been enough time. Now, the CPSC that we talked about before, they've made some safety standards for the bedside attached models, but they haven't made any yet for the in-bed sleepers, so that remains to be seen. Again, these are relatively new, so the actual safety level remains to be determined, so let's watch out for updates on the verdict for these products. Oh, one more point about co-bedding. It's especially important to avoid if the adult smokes. So if you're a smoker, I hope you quit because that's an independent risk factor for sudden infant death. But if you do continue to smoke, it's especially important to not co-bed with your infant. All right, now that we have the correct bed with the baby face up in the right place in the room, the next is what else is in the crib with them, and the answer should be nothing. So for blankets, either tightly swaddle them in a way that they can't get out of, which seems very difficult for a lot of infants. They don't like to be all bundled up, especially as they get bigger. Or they can sleep in those zipped up sleep suits that are neat and tidy, nothing loose to accidentally end up around their face. Unfortunately, a lot of babies who are found down during sleep have a blanket that ended up around the face. All right, they don't need any bumpers in the bed. These are products from a different generation of cribs, trying to prevent babies from falling through. They're no longer necessary with cribs that are up to standard now. And they don't need a pillow. They already have that big head, soft pillows that they can roll their face into. Not safe. And then finally, stuffed animals. Of course, we all have them, but Mr. Bear can wait until his friend wakes up from their sleep. So no stuffed animals in the crib while they're asleep. All right, one more thing about the sleep recommendation. This last one has pretty good evidence, but we don't actually know the exact reason why it works. But a way to decrease sudden unexpected infant death is the use of pacifiers during sleep. And the pacifier doesn't even have to be in the mouth the whole time to be protective. So put them to sleep with it, and if it falls out, you don't have to put it back in. Again, we don't know the exact mechanism. And of course, for breastfed infants, wait a little bit until the breastfeeding is established. But once that's established, by all means, put them to nap or sleep with a pacifier. And lastly, let's look at some of the general recommendations. First, we talk about babies being on their back so much. Sometimes parents are scared to put them on their belly ever. But tummy time is important and they like it. It's good exercise for head control and overall muscle development and coordination, so definitely do tummy time while being observed. Tummy time is a good thing. But again, just make sure you're awake and watching them. And hopefully they're awake too. All right, things to avoid. Smoking. We're not going to go into too much detail about this, but both during pregnancy and after birth, smoking is an independent factor that increases bad outcomes. Also avoid drug and alcohol abuse for obvious reasons. You need to be clear and alert while taking care of the baby. And then a third thing that sometimes we don't think of is to avoid overheating. No bundling around the face or making them so hot that they're sweaty all the time or hot to the touch. Remember that newborns should have one more layer than the adult. So if you're wearing a t-shirt at home, they could wear a t-shirt plus one more blanket. So these are important to avoid. And then things to do. Breastfeed is associated with a lower risk of sudden infant death. And I always feel like it's important to say, yes, we recommend breastfeeding. By all means, try to breastfeed. If for some reason it doesn't happen for you, please don't panic that this is putting your baby in danger. The most important thing is that he or she be fed. So if you're having trouble, talk to your pediatrician, talk to lactation, and let breastfeeding be a good goal, but not something that causes you too much stress if it doesn't happen for some reason. And the most important thing is that the baby get hydrated and nourished, which they can get from formula as well. All right, next point is get prenatal care. Fetuses that are healthier in utero do better after birth. And then lastly, vaccinate. This is an important point because at some point, people wondered if vaccines could increase chances of sudden infant death, but the numbers show the opposite. And the evidence shows that vaccination is protective against sudden infant death. So we've come a long way since SIDS in the cases of sudden infant death was first starting to be studied. And just to leave us with a scope of the issue, the current number stands at 3,500 cases a year in the United States of sleep-related sudden infant death. And of course, given this topic, Even one case is one too many. So the best thing we can do is to follow the evidence-based recommendations that really gives us the best chance of keeping the baby safe. So thank you, I appreciate your time, and we'll see you next time.